The Registered Nurses Professional Association represents the nearly 2,000 part-time and full-time nurses that provide care to the county clinics, jail. Here today because we need your help. We are in a crisis. Patients' care will be compromised if you do not intervene. We cannot retain our nurses. The nurses' morale is at an all-time low, and the stress level is high. Our newly trained nurses leave to work at our neighboring hospitals and pay more, and they receive more pay for less stress. Our senior nurses that retire or leave are not replaced with experienced nurses. We are a constant revolving door.
I'll give you a sentence to wrap up.
Okay. Along with that, the taxpayers of this county shouldn't shoulder the burden of constantly training these new nurses. It's very expensive to train them, but yet they're constantly going to other hospitals.
Thank you very much.
I also sent something to you also. I'm not sure if you received it.
Well, the clerk can take a copy of that and recopy it for us right now, if you don't mind.
Sure.
Thank you.
Thank you.
Next speaker, please.
Good afternoon. My name is Linda Hurley. I've worked as a nurse at VMC for a little bit over 10 years. I have worked on 5 different units. I currently am the secretary of RNPA. Over the past 2 years, our one unit that I work on, 4Med, I also work in PACU. We've lost on that unit 36 nurses in the past 2 years, soon to be 38. The experienced nurses train the new nurses only to see them leave after their training is done and go to work for other hospitals in our area that pay $12 to $30 more an hour. It's disheartening and it's really stressful for us that are behind. We can't keep our newly trained nurses because they can't afford to live in Silicon Valley on what we're paying them. The consequences of this attrition has had a negative impact on patient care, and the total effectiveness and morale of the entire hospital is also affected. It is a known fact that nursing circles that neighboring hospitals sit back and wait for us at the county to train their next RNs. The underlying problem is seeing the situation as just dollars and cents and not addressing the human factor, both patient and healthcare worker. The hospital has been in a crisis mode for some time, and its patient safety is greatly compromised. Please show us through your actions that you value the work of our nurses by ending the staffing revolving door and bringing our healthcare system to a competitive level to recruit and retain our experienced nurses.
Thank you for being here. That concludes the request to speak today. In terms of the yellow slips that I've received, I don't see anyone else coming forward. So we will now start with item 10A. And